You are about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
We are back on the Dr. Daliah Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So one of my listeners wants to be anonymous, but is a physician who disagrees with me and says they want the federal government to make rules as it pertains to transgender care, abortion, because being a physician, you are at risk based on liability if the state changes their mind, etc. And so I find that interesting. As a doctor, now I'm supposed to do no harm. And I am also supposed to practice within my scope. I'm supposed to help individuals in need, but I am not supposed to do things that can hurt, can maim, can cause lifelong pain, could kill, or is beyond what I am trained to do. And so, interestingly, there's, I guess, a Montana law that will allow people who receive transgender care to sue their provider for up to 25 years after the procedure if they claim they were harmed by it. Now, doctors get uneasy when they get sued for what they believe to be as doing their job. And we are very conflicted in the medical community with, is transgender treatment palliative? Is it altruistic? Is it helpful? Or is it harmful? And you have many doctors who think that we're harming people. You have many doctors who think we're helping people. And so it's really up to state boards and their laws and states to decide what it is that they want. Same thing with abortion. You have many doctors who will never take the life of a fetus. They're there to help the life of the fetus, help the mom, help the baby. They will not do anything to curtail that life. You have others that will provide abortive care and terminations, feeling they are helping the mom. So doctors are conflicted. I am of the mindset to keep the federal government and to keep the government out. I think the more the government gets involved with medical issues, the more things get messed up. I think it should be between a person and their doctor and the family and the father of the baby and the mother and I think but when you have a politician, to me, I think the federal government needs to stay out, especially since the narrative right now is the government wants to interfere with abortion or medical care. If the government's out, then the government's out. It's between you and your provider. And so I think the more people we involve in these decisions, the more people get involved. You saw what happened with Walgreens, and Governor Newsom was starting to go after Walgreens in California because there were some pharmacists who did not want to administer the medication that could kill a fetus and end the life of the fetus. And so why are we subjecting Walgreens to this? If a doctor wants to prescribe abortive medications, the doctor can dispense them themselves. You see, the medical provider, they send you the medications or they provide it on your way out the door, and we leave all the other people out of it. Leave the taxpayers out of it. Taxpayers shouldn't be needing to pay for abortions, for transgender surgery, for cosmetic surgery, we need our taxpayers to pay, for Medicaid and Medicare and children's health and cancer and all that. But once you get the taxpayer involved, now they have a say. So I don't know if that's right, left, conservative, liberal. I just feel like the government needs to not be involved. We don't have a law that says this is what you do, this is what you don't do. But Montana, very interesting. If you could sue your provider up to 25 years, that starts to change the statutes of limitations. So In many states, if a doctor messes up with the delivery of a child, that child could sue up to 18 years. And this is why obstetricians' malpractice is so expensive, because they need to have coverage for 18 years after that child was born. So if you could be liable because somebody's fertility was affected, somebody did have pain from the vaginoplasty or the genital procedure, or they got a blood clot from the high doses of hormones, and they could sue. Many providers are going to be like, I'm out. But you have some states where they could sue if a doctor does not provide the care. They could say, you're providing obstacles, you're not helping minors who want to transition. And as a physician, you're like, well, wait a second, I'm damned if I do, damned if I don't. How I would do it is I'm not trained in transgender medicine. I never went through formal training. So when I would have a patient, and I did have patients that would come and say, look, I want to transition, I would refer them to a specialist who did manage that, because I wanted them to get the right care. That does usually absolve you from any liability. If you are not trained and you try to do it, say, but I just wanted to help them, that doesn't protect you. Let's say you have a woman that doesn't like her breast implants, and she says, I don't care, doctor, it's too expensive to go to a plastic surgeon. Numb up my breasts and pull out the implants. And you're not trained or board certified in that, you're in trouble. You can't use the, well, I wanted to help her defense. So any medical provider that is not adequately trained should not be performing those procedures. Now, there's a lot of catch up now that they say gender dysphoria has spiked 133% in pediatrics and adolescents, but you're hearing more and more doctor groups saying, look, we can't be doing this on kids. There's more harm than benefits. And so anybody who is going to be trained better also be very well versed on the studies and what's happening in Europe and what is the proper thing, the proper path. So, getting the feds to say all doctors should perform this, or I think could be a mess. 1-877 Doc Daliah, don't go away.
Let's see, if something costs less, but people are happier with it, that sounds like something to look into, and that's MediShare. Maybe you've heard switching to MediShare to pay for healthcare can save the typical family $500 a month, and that's huge, but it's also true that people are way more satisfied after making the switch, too. The customer satisfaction rate for MediShare is double that of the typical health insurance plan. Double. MediShare works. It's been around for more than a quarter century, and members have shared more than $3 billion of each other's bills. People love having telehealth and a huge nationwide PPO network. So, yeah, you can save a ton and like it better. Imagine being happy with how you're taking care of your health care. So if you're self-employed or part of the gig economy, or you just want a plan you're happy with, you can call right now and get a price within 2 minutes. A very, very smart use of 2 minutes. Here's the number you need. 855-SHARE-40. That's 855-SHARE-40. 855-SHARE-40.
Hey guys, it's Dr. Daliah. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our fantasy football pocket guide for beginners found on Amazon, or follow the links on X and Facebook. That's Fantasy Football Pocket Guides for Beginners. Don't be left out.
In a study, it was found that 33% of 44 herbal supplements had no trace of the advertised herb. Don't let that happen to you. Hi, this is Dr. Mitch. If you want to ensure quality, please go to TotalWellness.com. Supplements made for physicians, only now available to you too. TotalWellness.com, helping you to look good, feel good, and enjoy total wellness.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen. And big thanks to Daniel, our producer. So we spoke a little while ago about how many men are reluctant to perform CPR on a woman because of the risk of being accused of inappropriately touching her. And I told you guys, listen, okay, I don't care. If you have to perform CPR, I don't care if you're anywhere near the boobies. For the love of God, please save my life. Duck when you loosen the bra, because you could get, these puppies are really constricted in a bra. So just remember to protect yourself if you do have to loosen the bra. But please save my life. I am never going to accuse you of assault if I need CPR. But there has been this societal instruction on things men do that they need to stop doing that is starting to, that has been now for a while, given the message to men that you're going to screw up and you're going to screw up bad. And as a result, we are seeing more and more men avoid women. We're seeing changes in the dating sector. We're seeing changes as it pertains, in the workplace. We're seeing changes in the classroom. This is an interesting article. I'm not going to read the whole thing, but I'm going to tell you some of the highlights of it. And when you look at this, if you were a guy, you might be like, okay, there is no way I'm not going to accidentally follow it to a T. I don't want to be accused of harassment. I don't want to lose my job. And so this was an interesting article. I'm not saying it's wrong. There's some things in it that were right, but it's pretty overwhelming. The article is called 21 Subtle Ways Men Disrespect Women Without Even Realizing. Now, this is being reported by the Morning Carpool. So they say you're disrespecting women when you interrupt a conversation. I am a huge interrupter. I don't know why I do. I don't know if it's part of my hyperactivity. Maybe it's because I think I'm going to forget what I have to say. I interrupt. I don't mean that to be disrespectful. I'm not being anti-man. I'm not being anti-woman. But if you interrupt a woman, that is disrespectful and could be assumed to be misogynist. If you dismiss their expertise. So if somebody says, hey, look, well, I've done this. I mean, I've dismissed men's expertise, not on purpose. So if my husband said, well, I built this, and I'm like, did you really build it? I mean, we do it to each other, but if you do it to a woman, that can come back and haunt you. If you underestimate emotional labor, okay? If you make decisions unilaterally. So if you are a manager, if you are a CEO, if you have to make a decision, if you don't involve or include them, or you forget because you made a quick decision, that could be disrespectful. Now, I'm not saying this is wrong. If my husband made all the decisions, I'm like, excuse me, can I have some 2 cents? Yes, I would feel disrespected by that. So they're not entirely wrong, but these start to add up and you get overwhelmed. This one I agree with, using pet names in professional settings. I can't tell you how many times somebody called me darling, or babe or sweetheart. I understand that it's sometimes a term of endearment, but not in a professional setting. Calling me sweetheart, I'm not going to make a federal case about it, but I prefer to be called Daliah. Expecting domestic duties. They say the assumption that women will take on the domestic chores. Yes, that is disrespectful. I agree with that. However, if you have an agreement where you're outside and you're working and you come home and the other person is not also working similar times, then, how do you address that? Which we'll talk about as well. Not acknowledging physical boundaries. So you don't go into another person's space. You have to be very, very careful with that. That I agree with. But it doesn't mean you're misogynist. It just means, you got to understand that could be considered inappropriate. Assuming a woman needs help. So this is where you're damned if you do, damned if you don't. If there is a woman that needs help and you offer it, that could be a no-no. Come on. Anybody who offers me help, thank you. I'll tell you if I don't need it. I'm good. Thank you. But offer it They're saying that if you assume they need help and offer it. So you see a woman running, looking panicked, you're not going to help her. It's starting to cause men to feel like, stay away. If you're going to be damned if you do, damned if you don't, you're going to end up not helping them. Let me see what else. Making assumptions about their interests. Okay. Taking credit for their ideas. Yes, that's a biggie. Don't do that. Failing to listen actively. So a lot of men panic about how to show they're listening. Me, I like to multitask. So if I'm in the middle of something and my husband's talking to me, I'm going to still continue it because I like to finish something through, but I'll also look back and forth or whatever. You do that, that could be looked upon as misogynistic. So I'm not going to read the rest of the 21, but the moral of the story is many people feel like they're going to do wrong and they don't know what to do. And we've heard from employers, they're nervous because they don't want to be accused of, harassment. They don't want, if you compliment a woman, is that going to be harassment? So instead, somebody walks in, do you say hello? Do you say hello, ma'am? People are getting so afraid because society is trying to make sure everybody does everything right that nobody's getting the memo or even understanding the memo. We talk about misgendering in the workplace. This is causing a lot of problems because people are so afraid of addressing somebody professionally as Mr. or Mrs. or Miss that they're like, hi, Judy. Hi, Bob. Well, yeah, I remember in typing class, you got in big trouble if you went straight for the first name. That was unprofessional, and it was disrespectful to go straight for the first name. But people are so afraid of misgendering that it's the lesser of two evils. You're safer being unprofessional and calling them by their first name than using a Mr. or Mrs. And when you have society so fearful that they're going to do something wrong, their only option, if they're damned if they do, damned if they don't, is to recede, to avoid. And I get that all the time. People are like, hello, what's your name? They're just so afraid. And I'm like, my name is Daliah. Can I call you Daliah? Yes, you can. It's okay. Relax. You can call me Daliah. Okay. How can I help you? And you almost feel like they cannot wait to get the hell off the phone because they don't want to do anything wrong. Listen, you're not going to do wrong by me. As long as you're not anti-Semitic, as long as you're not bigoted, racist, as long as you're not mean, you do your job. I'm not going to sweat did you call me Mr. Mrs.? I was at a drive-thru and somebody asked me, would you like fries with that, sir? Because my voice is lower. I'm like, I'm not a sir, I'm a ma'am. I didn't care. I thought it was funny. But some people, whoa. Oh, my God, they are going to want bloody legal retribution. And so, I think if you don't want there to be a fear of women being hired, of women being, involved, and, we have to figure out how to lighten up on all these rules and restrictions because people are so fearful that they're going to do something wrong. The obvious should never exist. There should never be harassment. There should never be assault. There should never be non-equal pay for equal work. But when we have all this fear that you're going to do something wrong, we're going to obviously something's going to come up from that. So from a health perspective, I'm hearing from patients because I'll ask them. I'll go, when was the last time somebody listened to your heart? They'll say years. And I'm like, when was the last time you saw a doctor? Oh, 2 months ago. For your blood pressure. Yep. And they didn't examine your heart? No. He never puts a stethoscope on my chest. Is he being lazy? Or is he fearful that if he goes there, there could be an accusation? I have heard time and time again, there are physicians that will not touch a woman's body in fear that they could be accused. Because we have heard time and time again, people say the doctor assaulted me. I had one patient who said that the doctor had put the stethoscope on her And it was inappropriate because the stethoscope was on her breast. And the doctor had called me saying, look, I listened to her and she gave me a weird look because I was listening to her heart and I put the stethoscope on her chest. And I'm like, okay, yeah, yes, now we're training students to ask the patient, which I don't know if I'm comfortable with, ask the patient to move their own breast out of the way, which a lot of women don't like to do. How I used to do it is I would put the stethoscope on and then I might move the breast with the stethoscope to listen to what I need to. You're having doctors say, to hell with it. I'm out. It's safer. It's not safer. How is that safer? Not listening to your patient's heart. But this is where we are because people are so afraid of doing it wrong. 1-877-DOC-DALIAH. Don't go away. Hi, guys. Dr. Daliah here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdaliah.com. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
All right, we are back on the Dr. Daliah Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So we just had a bunch of primaries in Nevada, Ohio, and, we're obviously what's on our mind is the election and what voters want. I was watching this one news segment where they were interviewing people. Some people felt immigration was one of the biggest issues, another economy. Somebody said global warming. They said the biggest issue to them was global warming. Now, I find that fascinating. I do love our environment. I am concerned that we might have another, ice age. Maybe another Grand Canyon develop. I don't think those happened because of cars and because of, our eating hamburgers. But I would like to make sure that we do have our environment. It's not the number one pressing issue, especially since I don't really see how our current president is really, able to control the globe and the sun. But, one thing that has been brought up a lot is education and what's happening with our kids. And so this is interesting. In New York, they say that the state education department has announced that they are going to basically not necessitate passing the 5 state regents exams to earn a diploma. So essentially that diploma is just a piece of paper. According to the state education department, all students will have to show nebulous knowledge and skills in 7 areas, including critical thinking, cultural competence, and global citizenship. High achievers who pass enough Regents tests will not get distinctive diplomas. All right. They said instead, every district will confer the same diploma on every senior who meets these quote unquote watered down requirements. So every graduate gets the exact same trophy. And the cultural competence, global citizenship, this is kind of confusing parents into, okay, so they're not learning algebra, they're not learning a secondary language. Is this going to be a lot of woke stuff? There has to be no, I guess you don't have to show any proficiency in math, science, history, and this is making a lot of parents nervous. Me as a physician, I teach students. My students need to be able to calculate an antibiotic dosage. They have to understand peaks and troughs as it pertains to plasma concentrations of medications. They have to understand the chemistry of the medications. The reason why pre-med students have to take so much math and chemistry and biology is because they need that as the framework of medicine. And what I fear as a doctor and what I fear as a parent is if they decide, like they did with COVID, that these traditional time-honored truths of education can now be thrown out the window, and all you have to do is learn a task, just do that task, and you're competent and you get to move forward, we are not going to have people that can pivot, that can be cross-trained, that have worked their mind such that they have that elasticity to pick things up. I am not a fan of the 36-hour shifts I had to go through and the books upon books and books and hours and hours and hours of reading a day to be able to pass my pre-med classes and medical school classes. But there was one thing that came out of that was really good, is I was able to push my brain to levels I never thought I could. And to this day, I remember things that got pushed in there that I would have never even thought I had the capability of remembering or learning. And it allowed my mind to, when you are doing the vast industry of medicine, to be able to be open to learning things, figure out how to learn, figure out how to compartmentalize, how to remember them. School is not about, who wrote Macbeth. It's when you read Macbeth, why does that sentence mean something else? What are we inferring? And so you're teaching your brain to be elastic. And it takes a lot of work. You're teaching discipline. You're teaching kids how to pay attention. You're teaching kids how to complete a task. And I told you how schools need to change. I know I sound like a broken record. Schools should not be all day long 50-minute classes. The core lessons should be done easily in the morning in 20-minute increments. They learn their cores in the morning. They eat lunch wherever, either at home where they think it's safe and they're not bullied, or at a cafeteria, whatever. And then the afternoon is all practical learning. The afternoon, starting from kindergarten on, exposes kids to everything they need to know in real life. Self-defense, first aid, farming, gardening, hunting, survival skills, welding, electricity, legal, medical, education, such that by the time they finish sophomore year, 16 years old, they have had exposure to almost every industry and can make an educated decision on what they liked, what they want to pursue, and, what life might be like in that field. High school ends there, and then their free college is their junior and senior year, age 17 and 18, still on school campus, still it won't cost you another dime to do free college. And then by the time kids are 18 years old, they either have an associate's degree or they have a trade certificate. And they could be out there at age 18 already making money, paying taxes, being productive. That's how I think school should be. And none of this 3-month off summer vacation. You are losing just too much time in a kid being able to learn. But New York saying, look, you don't have to pass the test. Why is that happening? Is it because people aren't passing the test? And they don't know what to do with kids who don't pass the test? If you have a child that doesn't know the information, you spend time with them. It's almost like they don't want to be with the kids. They don't want to be around the kids. They're like, just get them out of here. What do we care if the child doesn't know algebra or doesn't know another language? Now, some of you have commented on, we have tech. Many of us are not using sin cos tan from trigonometry. Many of us are not using our Pythagorean theorems. Many of us are using calculators. I get that. But what if you don't have a calculator and you need to calculate the tip? Well, they provide the tip percentage. I know that. I know in restaurants they provide the tip percentage. Have you ever done the math to see if it's correct? Oftentimes those tip percentages are wrong. They're screwing you over. If you don't want to be screwed on the money you're giving, you might want to know your math. With the languages, people say, well, you don't need to know a language because we're going to have Google Translate. No, I think it's very important to know a language. In fact, study after study has shown that if you're bilingual, you have a lower risk of dementia. Now, why is that? Is it because for you to be able to speak and manipulate both language and navigate between both languages, you have to use your mind more? The less we use our mind, the more dementia we're going to have. We have to keep using our mind. Now, I understand there's other things causing dementia, but one way to stave it off is using your mind and being very active mentally. And so if a child has no consequences, they don't have to pass, they don't have to show proficiency, then are they going to pay attention? See, I'm not saying it's the right way to go, but the fear of you failing a test made you pay attention, made you do your task. Why? Because when you're outside in the real world, if you fail to do your job, you get fired. School prepares you so you don't get fired. Well, maybe it's because we're not firing people either anymore. 1-877 Doc Daliah, don't go away.
Considered by most, optimized curcumin is one of the few bioavailable and highly absorbable curcumin products on the market. Hi, I'm Dr. Mitch. Since most chronic diseases have inflammation, our optimized curcumin seems to be a perfect addition to any nutritional program. It makes sense to me that preventing or reducing inflammation is a key component to our overall health. The Mayo Clinic found that curcumin can decrease swelling and inflammation, has antioxidant properties, and research suggests that curcumin can prevent cancer, or at least slow the spread of cancer, and in many instances make chemotherapy more effective. It protects our healthy cells even from radiation. TotalWellness.com, where we help you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877 Dr. Daliah, 1-877 DOCDALI. So, to statin or not to statin? That is the question. Statins, cholesterol medication, very popular cholesterol medication, such as Lipitor, Crestor, Zocor, known as rosuvastatin, atorvastatin, simvastatin, some of the other statins, have been a godsend as it pertains to decreasing cardiovascular risk. We have another study that's come out saying that they are associated with decreased risk for cardiovascular disease and death, even in older individuals. They looked at a study of adults aged 60 years and older, and they found that the use of statin therapy as primary cardiovascular disease prevention was effective for preventing cardiovascular disease and all-cause mortality, even if you were older than 85 years old. The study was published in the Annals of Internal Medicine. The researchers came from the University of Hong Kong. They used a target trial emulation design to investigate the relationship between statin therapy and cardiovascular risk. They looked at electronic health records, and the study looked at adult patients over 60 without any pre-existing cardiovascular disease who met indications for statin treatment. Patients with prior statin use, lipid-lowering drug use, cancer, myopathies were excluded. Liver issues were excluded. And the data showed that in all age groups, initiating statin therapy was associated with lower incidence of cardiovascular disease and all-cause mortality, even if you were over 85. And they said that the statin use did not increase the risk of adverse events such as myopathies, which is muscle issues, or liver dysfunction, because one side effect of statin use could be affecting the liver, elevating your liver enzymes, and causing issues with your muscle. So you see a study like that, you're like, wow, sign me up. Yet also today, we have a headline saying fewer people may need statins to prevent heart disease. So now we have a study being reported by NBC, meaning we might have too many Americans on the medication. They say a new way of determining heart disease risk may result in millions of fewer Americans needing prescriptions for statins. Well, so what? Do we need them or do we not? In this new study, Dr. Tim Anderson, an assistant professor of medicine at the University of Pittsburgh, and colleagues analyzed the potential impact of the new heart disease risk calculator dubbed PREVENT. It was released last year by the American Heart Association. They looked at 3,700 adults aged 40 to 75 who were participants in the National Health and Nutritional Examination Survey, the NHANES, and the researchers compared estimates from the new calculator to older guidelines. They said the Heart Association's new calculator was developed to give a more accurate assessment of a person's likelihood of developing heart disease by incorporating newly recognized risk factors such as kidney disease, obesity. And among the participants, they said the 10-year risk of developing heart disease determined with the new tool was about half that estimated with the previous one. And they said using PREVENT to calculate the 10-year risk for developing heart disease, the researchers determined that 40% fewer people actually would have met the criteria to use it, meaning 4 million people in the U.S. taking statins might not need it. So now, if you are a person with a heart, you're like, what do I do? Again, I get it. These studies come at us like ping pong balls. Talk to your medical provider. They're going to look at your risk factors. They're going to look at your numbers, and you and they will make a decision. These calculators from the American Heart Association are nice. They did remove race from the calculation, and instead they replaced it with a person's zip code. They said the zip code serves as an indicator for socioeconomic status. Now, they're not wrong in including zip code as a possible factor, but don't remove race. We have learned time and time again that certain races may have higher risk. You're really going to remove race? So they are calculating the risk separately for men and women, which is necessary. Women have been underestimated a lot as it pertains to heart disease. Women may present differently. Women may have different symptoms. There may be different risk factors. And so we do need to understand that there is a difference between the sexes. I understand there's this big push to not have any line between man and woman, but there has to be a demarcation in medicine. And the fact that the American Heart Association is needing to embrace you have men and you have women means we still need to have definitions and establishments of, who are you and what risk factor you are. But as a patient, if you are frustrated by the news and the headlines and the back and forth, I get it. That's why I'm here. I'm not here just to sit here and yell at you about your cholesterol or try to sell a supplement. That's not what my show is. My show is to talk about the current events, to give you the latest headlines, and to make heads or tails of what these mean. The statin medications, I feel, have been paramount to preventing heart disease. The man clutching his chest at 40 years old doesn't seem to be the typical picture anymore. Now that we have a lot more interventions and we are more aggressive when it comes to heart disease. I really feel my father would have not died at the age of 62 of a heart attack if he would have taken his cholesterol medicine, but he didn't want to. I don't want the Lipitor, leave me alone, it hurt my liver. It did not hurt your liver. Nothing happened to your liver. He just didn't want to take the medication. And I told him, you would have the healthiest liver in the cemetery. Who cares? And he didn't want to, and he ends up dying of a heart attack. His cholesterol wasn't even that bad, but because he had cholesterol and diabetes, it was a double or triple whammy. So we have to be very careful because, remember, some of these headlines are also having some other narratives that are being pushed. I'm not saying this one study, but there's a big push on doctors and the medical community and academia to find ways to save money and to limit the extra cost of healthcare and unwanted procedures and unnecessary treatments. So we don't want to have individuals spending money or undergoing something they don't need to go through. But we also need to be very careful about saying this group of people doesn't need it. Because let's say somebody dies. The article's not going to say we were wrong because they're going to say, oh, we only had 1% of the population die with this change. But look at how many Americans we say, oh, I'm sorry, if that one person died, that person died. See, in medicine, I don't want anyone to die. I don't care that, you know what, we have 5% or this or that. Okay, I want 100% people living. That's my goal. And I am not going to sacrifice somebody, just to, quote unquote, save money. That's not how I was trained. We have to help everybody. I understand there's triage situations. But look at what we did with colon cancer and prostate cancer. We forwent screening, and you had black men with aggressive cancers not getting picked up. I'm sorry, that was not success. I don't care how much money you saved. People were dying because we made the cutoff of screening too late. And we didn't embrace race and understand that race was an important factor. Just because you have a black man in a different zip code than another black man doesn't mean they don't get screened. So we have to be very careful. And as a doctor, I don't want to go against the grain. I understand what the medical community needs to do. We don't want people getting biopsied that don't need biopsies. 1-877-DOC-Daliah. Dr. Daliah here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Did you know that healthy arteries make a gas? Yes, actually 3 known gases. Hi, I'm Dr. Mitch, and nitric oxide is a gas that's readily made all day long to keep our arteries open by relaxing the blood vessel walls. By doing this, our circulation is increased, bringing blood, oxygen, and nutrients to every part of your body. Both age and poor diet can lead to a loss of this precious gas, and in turn, blood pressure can go up, energy can go down, and you can get tingling in your hands and feet. Well, our product, Ultimate Nitric Oxide, can easily help fix this lack of nitric oxide. Go to TotalWellness.com. That's TotalWellness.com, where we are helping you to look good, feel good, and enjoy total wellness.